Hey, how are you?
I'm well. How are you doing today?
I can't wait to get out of this place.
I'm sure. Well, my name is Leah. I'm the nurse, and I'm going to be going through some discharge teaching with you today.
My name's Polly. Polynesian.
Okay, Polly. So, we want to get you ready for discharge. That includes some teaching about the warfarin that your doctor's prescribed.
Mm-hmm.
So that's similar to what you've been on while you've been at the hospital, which was heparin. So this is just like your medication that you're going to be going home on.
Okay.
So what do you know about the med already?
Well, the doctor told me that it was to help the clots in my legs.
Mm-hmm. So warfarin is an anticoagulant, so that works by kind of thinning the blood,
Mm-hmm.
and it prevents clots from forming. So there are some risks that we do need to talk about. We just want to make sure that you're safe and you know everything that's involved.
Okay.
Especially because we know you like to skateboard.
Mm-hmm.
So we'll go over some of that stuff.
All right. I heard I might need to be on this stuff relatively long term, like 6 months. And I gotta tell you that 6 months in my life as a skateboarder, I mean, I just won the Australia Open.
Mm-hmm.
I don't know if you caught any of that on ESPN2, by the way, it was rocking. But for me, I won $25,000. I'm at the peak of my career. I can't take time off of my craft.
Okay. Yeah, I
I mean,
understand.
I'd rather die than take time off my craft.
Yeah, this is your livelihood. We totally understand that. There are some ways that, we can just make sure that you're safe. But we do need to make sure that your body heals effectively and that you do take some precautions initially.
Cool.
So for the first 10 days, we recommend that, you do something low impact like swimming,
Okay.
or you can do some upper body strength training just so you can kind of keep in shape and,
Yeah.
let your body recover a little bit.
I live on the ocean, that's perfect.
Okay, excellent. I know 6 months it sounds like a really long time. Yeah. So that is pretty standard therapy for someone who's recovering from a DVT.
Okay.
And with this medication, bleeding is the major risk. So we do like you to prevent yourself from injury when possible.
Okay.
So again, yeah, doing things like swimming or something low impact
So,
would be great.
like what kind of alternatives are you talking about besides the swimming?
Basically, the current recommendations are that you don't resume your normal activity until 6 weeks out. I know that's probably not an option for you because, this is what you do. This is how you make a living.
So I've got like 2.5 months till my next competition, so I could step back from it for a little while.
Okay. So yeah, again, swimming or walking or, doing some weight training or something like that
Okay.
would all be great. Any kind of core exercises, things like that. Basically just, give your legs some time to heal.
Okay, so maybe 6 weeks off my skateboard with these other therapies that you're talking about.
Yes, if you could do that. And then if you feel like, you want to continue skateboarding and, keep those skills up, just let the doctor know a couple days before you have any kind of event or anything like that, because he will be able to lower your dose and adjust that accordingly.
Okay.
So that your risk for, bleeding if you were to fall or, something like that. I know you're a pro, but happens to the best.
It does. Like when I get back on my board, am I good to go? Do I need to think about this anymore? I mean, are you gonna dress me up in a bunch of goofy pads?
I mean, I will suggest that you do use some extra padding. So, of course, wear a helmet. If you've got some knee pads, if you got some elbow pads, bust those out. Probably wear some protective clothing, like, maybe wear some long pants.
Okay.
Things like that, just to prevent you from getting any cuts or scrapes or anything.
I mean, it sounds reasonable.
Okay.
I really don't want to die, but I think maybe low risk activities I can get behind that.
Sure. We just want to make sure you're safe, but we also recognize that, this is a really big deal for you and, we don't want you to step away from, your whole life for this reason.
That's good, because I won't.
Okay. Well, yeah, we can meet you where you're at and come up with something.
Cool. Awesome.
So has anyone taught you about the signs and symptoms of bleeding?
So, yeah, the doctor talked about some bruising. He said something kind of weird. He said something about my poo, but I really didn't get what he was getting at. So it made me feel a little uncomfortable.
Okay, so that is kind of a sign of, if you had any bleeding in your stomach,
Okay.
Your poo would be like dark and kind of tarry looking,
Okay.
or it would be red.
That's what he was saying. That makes a lot more sense now. It actually makes me feel a lot more comfortable with him now, too.
Sure. He's more talking about like that internal bleeding.
Gotcha.
That's one of the major signs.
Okay.
And then bruising as well.
Okay.
So any of that stuff happens, just go ahead and give us a call.
Okay.
Yeah. And then there are a couple other things to keep in mind aside from the safety. So we do know that vitamin K does interact with warfarin.
I don't take any vitamins.
Okay, well, it is found in kind of higher quantities in green leafy vegetables and some dairy products.
Okay.
If that's already a current part of your diet, that's great. We're just asking that you don't add or take away anything from your diet. Just don't make any drastic changes there, and
We eat a lot of
you should
salads.
be good to go. Okay, well, if you're already doing it, that's just fine.
All right.
Yeah, just don't make any major adjustments because that could have some potential interaction, and
Okay.
we just want to make sure you're looking out for that. And then also, any kind of over-the-counter medications or even herbal supplements or anything like that, just go ahead and give us a call and run those by us before you decide, because warfarin does have a lot of drug interactions.
Cool.
Okay. So, do you have any other questions at the moment?
No, I just, I gotta come back for my checkups, right?
Mm-hmm. Exactly.
How often do I have to do that? What's the, I guess, maybe I don't understand why, if I'm on the medication, I have to keep coming back.
Sure. So for warfarin, it's a very individualized dosing that we do. So when we send someone home on warfarin, you do need to get some regular blood tests, and that's our way of determining how well it's working, how your body's responding to the medication, and then we do dose adjustments based on the values that we get.
So it's not like taking like 6 ibuprofen or...
Yeah, exactly. So it's, he'll send you home with a dose, and then for the first 5 days, you'll need to come in once a day so that we can do that blood test for you.
Okay.
So then we can adjust that, and then we're going to ask that you come in just twice a week for the next 1 to 2 weeks, and then once a week thereafter. So
Once a week.
Once a week.
Okay.
And that'll be, for the rest of your therapy.
Okay.
So if that sounds a little bit cumbersome, I know you probably, you just said you went to Australia, so it sounds like you probably travel a lot for work.
Yeah, I've got another, my next competition is in 2.5 months.
Okay, so if need be, there are home testing kits that you could purchase.
Really?
That you could do your own test, and then, we would give you some parameters based on the values that you would get.
Okay.
So that is an option for you as well.
Do you know how much that is?
It is a little pricey. I think it's about $2,700 for the
Okay.
kit.
But that could be worth it if I'm traveling and I'm not able to make it in.
Yeah, and that can be something that, down the road, if you are gonna be gone and you couldn't get into the clinic that week or, for a couple weeks, that might be something that we can talk about.
Okay.
That could be an option for you.
Yeah, I'd love some literature on it or something.
Okay, perfect. So just know that that is out there. And I know that this is a lot of information. Definitely gonna be sending you home with plenty of handouts and resources, things to look out for. And I just wanna make sure that I've been clear, so can you go over some of the signs that you're gonna report and?
So if I have weird poo, if it's dark or tarry, we're gonna talk about my poo.
We don't talk about it.
If I have bruising, you said if I'm dizzy, and you said something about being pale, but I'm Polynesian. Brothers don't get pale. But if I have any of those symptoms, to get in touch with you.
If you have any of those symptoms.
And you said to not change up my diet,
Yes,
and that if it does change, I need to talk with you guys.
exactly.
Okay.
It just might require, some more frequent testing just to see,
Okay. And then I'll
see how your clotting is doing.
And I'll come back in for my blood test, and we'll talk about that home unit maybe.
Yes,
Cool.
yeah, that sounds great. So now that we've gone over safety, I just wanted to talk about your use of ibuprofen and ranitidine.
Mm-hmm.
Can you tell me when you started taking those?
Yeah, so, now that I'm sponsored, they test for substances. And so I'm not able to smoke my marijuana like I used to. And I noticed that I was a lot sore. And so I started taking ibuprofen.
Mm-hmm.
A little while after taking my ibuprofen, I just noticed I started getting bad heartburn.
So that's when you started the ranitidine?
Yeah.
Okay, so from my understanding, you started taking the ibuprofen for aches and pains.
I put down the pipe.
Okay, so you started taking that,
Mhm.
and then you noticed you got heartburn after that had started.
Oh, yeah.
So then you took the
Yeah.
ranitidine?
Yeah.
Okay, so ibuprofen can be hard on your stomach, especially if you've been taking it for a long time.
Okay.
So that could be why you started getting the heartburn and why you needed to take the ranitidine.
Gotcha.
So, usually we recommend that you take ibuprofen short term.
Okay.
So maybe we can go over some other ways for you to, manage your pain, some non-pharmacologic ways for you to do that.
Like, what are you thinking?
Like massage or like Epsom salt baths or, hot and cold packs. Maybe you could try those things first.
Okay.
See if that helps you out. Do some extra stretching.
So my girl does yoga. Is that something that would work?
Yeah, that would be great. That would, do some strength training for you as well as, get you good and stretched out after a long day.
Yeah,
So
she goes with her girlfriends. It's perfect, actually.
Okay. So she can clue you in on that.
Yeah.
Okay.
I need a lot of instruction.
There you go. All right. Well, you guys can participate in that together, and that should help you out a little bit.
And the hot and cold packs, just kind of that normal.
Yeah, just some ice packs, or like you could get a little electric heating pad or something like that, and just try that stuff out. And then for if you do just feel like that's not working for you, just you could take some ibuprofen still.
Yeah.
But we just we recommend that you don't take it long term, and then that might even resolve your heartburn. So
That'd be
then you wouldn't
great.
need the ranitidine.
That'd be great, because that's pretty inconvenient.
Yes, exactly.
Cool.
So thank you for being so patient. I know this is a lot. And then I do have a handout, and I've also printed out a calendar. So we can write down you can write down when your events are,
Okay.
when you would need to call your doctor, when your appointments are.
Awesome.
That way you can just kind of keep track of everything. You can track your progress, see how everything's going for you, and that way it's just all in one spot. So if that looks like it'll work for you, then
Yeah.
we can go over that together.
That'd be great. Hey, you guys have been fantastic. I actually have my boy Brian said I wanted to give you an autographed skate ball.
Oh, thank you.